Hi everybody, I'm Pamela Atwood, Director of Dementia Care Services at Hebrew Healthcare. I'm a gerontologist, a certified dementia practitioner, and a certified laughter leader. In our Confident Caregiver series, we're doing something really special today. This is actually part of a course that I teach online. If you go to learn.org or yougotclass.org, which is you with a U, gotclass.org, you can see that I teach several different courses. And this is one of the learning modules for Lewy Body Dementia course. So this presentation tonight is about living with Lewy body disease. I am going to follow my curriculum, so it's a little more structured than I usually do on these videos, but bear with me because my students are used to me being a little more professional. What we're going to talk about tonight in this presentation are information about Lewy body disease and living with visual spatial disabilities or differences, bradykinesia, autonomic dysfunction, REM sleep disorder and REM behavior disorder, spontaneously arising Parkinsonian symptoms, cognitive impairment, and sensory processing changes. And really what we need to be comfortable with Lewy body dementia is that all of these symptoms basically can fluctuate. You have good days and bad days, which is true with everybody all the time. But when people have Lewy body dementia, what is really striking is that their symptoms can fluctuate so drastically day to day and moment to moment. They can have what a lot of families refer to as spells, where they're a little out of it, a little confused, disoriented, vague, not even connecting or responsive in some points. And what we have to do is really kind of make peace with going with the flow, responding to delusions or hallucinations, and that this is the new normal. In the PowerPoint presentation that I had developed for this class, I used a number of different famous people who have had Alzheimer's disease, Lewy body dementia, and the actress Estelle Getty, who played Sophia Petrillo on The Golden Girls, is one of the people who is famous and had a Lewy body dementia. She was originally diagnosed with Parkinson's in 2002, and with Alzheimer's disease was misdiagnosed as having Alzheimer's disease. She then had really in 2000 had stopped making public appearances, and she had announced at that point she'd been diagnosed with Parkinson's. Her cast members are quoted as having said, back then that she sometimes didn't remember them, didn't remember their names and when they would call and say hi, and that they then started to question if some of the problems she had in when they were casting, when they were doing the show, when they were filming the program Golden Girls, if she had some problems remembering her lines, if those were maybe some early signs or symptoms that there was a cognitive disease process going on here. Estelle Getty died in 2008, just shy of her 85th birthday. One of the symptoms that's very common with Lewy body dementia is REM sleep behavior disorder or REM sleep disorder. And it's so common, in fact, that there are some scientists who believe that REM sleep disorder in younger years might be an indicator that you're at risk for getting Parkinson's or Lewy body dementia later in life. What happens here is severe nightmares, and for a lot of patients, they're actually acting out the nightmares. This can be very dangerous for the patient as well as for the care partner or the bed partner. And what happens here is they can unintentionally injure themselves or their partner. Some of the recommendations that they make for people living with Lewy body dementia and having this condition or the rapid eye movement disorders is to use padding on the foot of the bed and on the head of the bed and on the floor just off the bed. That can make it a little bit higher risk for tripping if you're getting out of bed, but it's better if you fall to reduce the head injury risk as well as other injuries. Also, you might want to move away, you should move away furniture with sharp corner edges. And it's very important for partners, and some partners actually choose to sleep in a different room or in a different bed, in separate beds, but it's really important for the care partner to know not to wake up the person who's having one of these nightmares. Don't wake them up. That will just increase their disorientation, and they may actually be more at risk of harming you at that point. You want to journal the incidents for the physicians, for the clinical team, including the frequency, the duration, and how intense it was. And some doctors will recommend melatonin, but make sure that you only add that if it's prescribed or recommended by the physician. Melatonin is actually a naturally occurring element in our body, and it can become a little off balance with certain kinds of changes and with normal aging. Some of the cognitive problems that happen in Lewy body dementia, it causes a dementia, obviously, hence the name. But what's really important to remember is that the dementia is actually a little bit different. It's more of a processing than a memory change. For some folks, and dementia, of course, being just a general loss of intellectual processes like reasoning, judgment, and memory. With Lewy body, they, like other symptoms, they may have that cognitive loss, but that can also fluctuate day to day. The visual, spatial, and organizing cognition, so time, relation, distance, and we'll see this a lot with driving, those are some of the most common changes in the processing cognitively. Depth perception as well, judging distance from point A to point B. These are some of the changes cognitively that we see early on. Eventually, their short-term and long-term memory will get affected as well. Planning and sequencing and judgment reasoning may be more impaired than memory in the early stages for people with LBD. And what we have to really do for that is really kind of anticipate some of those safety changes or some of the challenges. Like I said, driving, cooking, different kinds of processing like planning an event or a party can be an issue, but they may leave the stove on, so it's not just the planning, but it's also how we apply the learning for safety as well. They may also be giving funds to scam artists or to a ne'er-do-well nephew or something. And of course, like I said, the driving. Also, make sure that they're not eating spoiled food. Again, some of the processing sensory changes of, oh, that's been in here too long, or it's moldy, I should eat it, or it smells. Very, very common that Parkinson's, and because Lewy body is related to Parkinson's patients lose their sense of smell. So they may not have the sense of smell that says this is spoiled or this is toxic. I just was at a conference last week and they were doing it was a slide basically showing some of the differences on household safety, and it was, I understand, a slide from the poison control centers nationally, and it had like a mouth rinse and a dental rinse and a blue cleaning fluid and a bleach, and they were all like the same color blue liquids. If you had Lewy body dementia or another kind of dementia, you may not be able to differentiate, and your sense of smell change doesn't give you the alert for safety that says, ooh, chemical, that's not good. With Lewy body dementia, there are also sensory issues and behaviors that can relate because of the sensory changes. For instance, sensory input, we really have to manage for that. The hearing and the vision can change, and some of that's associated with aging, but also these changes adapt or need adaptation when someone has Lewy body dementia. We want to make sure that lighting is appropriate, keep it adjusted, and for safety, especially limiting shadows. Be mindful that reality television can be very damaging. They really will believe that this is really happening to them and that they have to get out and take care of the town from the invading, war issues that are going on. Most common accusations. Now, a lot of people with cognitive impairments make accusations, but in my almost 30 years of experience working with dementia, it's people with Lewy body dementia that are most often accusing a spousal infidelity. And really what this is it's a confusion of what's going on. So in the moment, they're thinking, well, I don't feel sick and I don't have a need for an aide, so why is this person here? Well, my husband must be having an affair with the aide. That's what's going on here. They also will accuse people of theft of valuables. And really, we have to respond to the feeling, which is, I don't feel safe, I can't remember what's going on, and protect people with dementia from their two fears, which are to look stupid, no one wants to look stupid, and that they're going to look crazy. And so for people with dementia, those are their two fears that we really have to protect them from. For sensory processing, I have a son who has sensory processing disorder, and it was really a developmental delay. He's really adapted to it quite well. But when he was a young child, we had to give him a sensory diet. And this is something that we can do for people with Lewy body dementia. So how do we adapt as caregivers? We can give them more sensory processing so that their brain is kind of grounded. A weighted blanket, or one of those shoulder and neck massager things that are a little weighted or warm. You have to be careful not to make it too hot. You have to check the temperature. But those kinds of things can really help the person feel grounded. Also, aromatherapy. Exercise, physical hard work will help their brains feel more stable and grounded, and will reduce some of the challenges that come with that sensory processing. And kinesthetic interventions, touch things, different textures that their brains can process. Very, very helpful for this population. And that really helps with a lot of the complementary interventions. It's really important. There are no good pills for this. The medications for memory make their Parkinsonian symptoms different, and the medications for Parkinson's make their cognitive changes worse. So we have to really balance it, and I'll talk more about complementary at the end of this video. Some of the typical symptoms that we see with Lewy body dementia include frequent falls. That's one of the hallmark indicators, along with tremors or a slowness of movement, freezing, and that fluctuating movement. Now, or fluctuating alertness. A lot of times the orthostatic hypotension is what's causing the falls, and that's a drop in the blood pressure with a change in position. Orthostatic hypotension can be caused by a number of different things. It can be caused by medications, it can be caused by dehydration, and it can be caused by an autonomic functional dysfunction problem, which is part of the Lewy body dementia. Bradykinesia is the term that we use for that slow movement, slowness of movement. It can take, normally we say 30 seconds for someone to respond. For someone with Lewy body dementia, it can take up to 90 seconds, a minute and a half. And they're then responding functionally and cognitively to what it was you had asked them to do. For fall prevention, we want to first make sure that we have good physical therapy involved to improve our functional range of motion, our endurance, and our strength. And we also want to keep an eye on that blood pressure. Like I said, that blood pressure fluctuation can help cause the falls, so we want to make sure that we're managing the blood pressure medically. Talking to the doctor is helpful because there are sometimes people are on multiple cardiac meds. You don't want to just stop those medications, but they may actually be contributing to the risk of falls. Also, you want to make sure that people are sitting at the edge of their bed or their couch or whatever for a few seconds before they stand up. So if they're getting up from a lying down position, sit up, wait a couple of minutes or a couple of seconds, at least good 30 to 60 seconds, and then stand up. Give that blood pressure time to equilibralize. Whatever. I can't remember how to say the word. I can't get it. I have a blank. Equilibrium. Equalize. Something. You understand. Also, a fall-safe method. This is for people who are at risk of falling out of bed. What you do is you put the edge of the bed to a wall. You tuck in the three sides. So you tuck in the foot of the bed and the side of the bed. That third side you only tuck in at the hospital corner and then leave the rest open. This will help prevent the sheets from becoming untucked and the person getting tangled in them when they're trying to get out of bed. Also, for chairs, make sure you're using chairs with arms. You want to eliminate those throw rugs, and I know everybody loves them. Hang them on a wall. Make something out of them. Do something hang them on a wall if they're a really expensive oriental rug or something. But try to keep them out of a fall hazard. Try to keep them from becoming a fall hazard by putting them outside of the walking path. And then being aware that crossing thresholds and the freezing that can happen, like with Parkinson's disease, they tend to get stuck at thresholds. Just give them a little extra time and help physically coach them through that. For the Parkinsonian tremors, remember that tremors really cannot be controlled. Reducing the anxieties, doing meditation and stress management may help limit that. Avoid rushing because that makes us more anxious and have more tremors. But also the two features that can increase falls are the festinating gait, which is where the legs don't seem to catch up with the top part of the body, and a shuffling gait, which can help make that person fall, but also retropulsion, which is where the person is falling back. Both of those kinds of things can happen with regards to Lewy body dementia and Parkinson's disease. So the freezing, like I mentioned, over threshold, you want to make sure that those medications that you're giving aren't contributing to those motor symptoms. At this point, you really, if falls are such an issue, you want to make sure that you are talking to a movement disorder specialist, because they're going to find that right balance of medications to help minimize the risks. For the fluctuating alertness, some of the things to do to live with that, and part of that can be just a weakness, a balance, a loss of coordination, but with that vague kind of spaced out, kind of not focused attention. Those spells of altered consciousness are what I'm referring to for this fluctuating alertness. And that can also be evidenced by heat intolerance, a perspiring or a diaphoresis where they're looking really unwell, and hesitancy or urgency on urination can also, some dribbling can also be associated with that alertness. Some of the things to do, again, make sure you're minimizing the risk of injury for falls if they're losing their balance, anticipating urgency and keeping those pathways clear. And then adjusting the diet to a lighter food. When your loved one is having one of these spells or this altered consciousness, they're not going to feel like themselves. And so while we might want to say, here, you're going to eat, you're going to feel better, we really want to avoid doing that. Keep a lighter fare so that they're not feeling as disconnected, and make it maybe an altered diet so that they don't have to chew as much. And they won't choke. You got to watch out for the choking. And then again, make sure your physician is kept aware with the frequency, the duration, and the intensity of these episodes. Some of the complementary interventions I promised I would mention before the end of this video. Aromatherapy is really very important and very helpful. Again, because sense of smell is diminished in some of these conditions for Lewy body dementia and Parkinson's, try lemon. Lemon especially is helpful. It's important, though, that you check with your physician. Anything that the person can't have through diet, you shouldn't give in aroma. For instance, if someone is on a medication for cholesterol, what happens is most of those you have to be very careful, and you can't have like grapefruit. So you want to avoid a grapefruit essential oil. Check with the physicians before starting any of the essential oils, but aromatherapy really can be very, very helpful. Also, pet therapy is great therapy. It's a wonderful sensory input, and it's very calming and soothing to manage both tremors, anxiety. You want to make sure you're not also contributing to fall risk. Don't let them trip over those cute little dogs and cats. Make sure that the person is using them safely. For a lot of people, when we're talking about how to get more exercise, walking a dog or a neighbor's dog may be wonderful exercise. Make sure you're eating a well-balanced diet. Fruits and vegetables, a lot of healthy, unprocessed food is the best way to do that. The brighter the colors, the deeper the colors, the better the health, the antioxidants and the nutrients. Exercise, yoga, Tai Chi. My husband just got certified in a program called Ageless Grace, which is fabulous. I did it last night and I'm a little sore, but it's really, really good exercise because it's tied in with physical activity. It's all chair-based. You can be chair-seated the whole time, and works on your brain health as well. Expressive arts, art therapy, music therapy, movement, dance, all of these things are great complementary therapies. Spirituality, keeping connected, saying prayers, having a calmer affect, doing meditation, all of those kinds of things are important. And don't forget the kinesthetic benefits and the relaxation benefits of massage. Those are all wonderful complementary medicines that really can help living with Lewy body dementia and having the complex symptoms be managed so that somebody really can live with it. All right, that's the end of my video today. For my students, I'm sorry that we couldn't do this in the traditional way online through the course technology, but hopefully we'll get this information to you and it'll be just as helpful. For my confident caregivers, I hope this is good information for you and helpful, and I look forward to our next video. Thanks and have a good night.